Welcome to our final lesson of week 2. This week we've covered a lot of ground: digital epidemiology, AI-assisted scanning, primary data collection, and asset mapping. Now comes the crucial step: synthesizing all of this into a coherent problem statement. A good problem statement is not just a description of what's wrong, it's an actionable understanding of why the problem exists and what would need to change to solve it. This is where analysis becomes insight, and insight becomes the foundation for intervention. By the end of this lesson, you'll be able to accomplish 3 objectives. First, synthesize multiple data sources into a unified narrative. You have epidemiological data, survey data, qualitative insights, and asset information. How do you bring these together into a coherent story? Second, apply the 5 whys technique for root cause analysis. This simple method pushes you past surface level understanding to identify the fundamental causes you need to address. And third, write clear, evidence-based problem statements that can guide intervention design. These statements will be the foundation for everything that follows in your program planning. Before we dive into how, let's understand why problem statements matter. First, they clarify exactly what you're trying to address. Without this clarity, programs drift. They try to address too much or lose focus on what matters. Second, they provide focus for intervention design. When you know precisely what the problem is and why it exists, the intervention becomes clearer. You're not guessing. Third, they establish shared understanding among stakeholders. Everyone needs to be working on the same problem. A clear statement ensures alignment. And fourth, they create criteria for evaluating success. If the problem is well defined, you can measure whether you've solved it. Vague problems lead to vague evaluations. You likely have data from multiple sources: quantitative data, epidemiological statistics, survey results, surveillance data. This tells you about magnitude and patterns. How big is the problem? Who's affected? Where? When? Qualitative data, interviews, focus groups, community conversations. This tells you about experiences and meanings. Why do people think this happens? How does it affect their lives? What have they tried? Asset data, the strengths you mapped. This tells you what resources exist to address the problem, what's already working, who's already helping. Synthesis means bringing these together. Look for convergence. Where do different sources agree? That convergence is likely truth. Also look for divergence. Where do sources disagree? That's interesting too. It might reveal complexity or suggest you need to learn more. The 5 whys technique is a simple but powerful method for root cause analysis. Start with the problem, then ask, why does this happen? When you get an answer, ask why again, and again, and again. Each answer becomes the subject of the next why question. 5 is a guideline, not a rule. Sometimes you reach root causes in 3 whys, sometimes it takes more. The point is to push past symptoms to underlying causes. Here's why this matters. If you address a symptom, the problem returns. If you address a root cause, you solve the problem. Many interventions fail because they target the wrong level. They treat symptoms while root causes continue producing the problem. Let me walk through an example. The problem: low rates of diabetes screening in a community. Why? People don't visit their doctors for preventive care. Okay, but why? They don't have regular primary care providers. Why not? Many are uninsured or underinsured. Why? They work jobs that don't provide health benefits. Why are those the available jobs? The local economy is dominated by industries that rely on part-time and contract work without benefits. Now we've moved from screening rates to the fundamental question of job quality and economic conditions. An intervention focused on health education wouldn't touch this. An intervention focused on expanding insurance options or changing employer practices might. This is the power of asking why until you reach structural causes. A useful structure for problem statements is "but therefore" it goes like this. First, describe what should be happening or what exists. For example, this community has engaged residents who care about their health. Then, identify the contrast, but. But access to healthy food is limited by the absence of grocery stores within walking distance. Finally, establish the consequence. Therefore, residents rely on convenience stores and fast food, contributing to high rates of diet-related chronic disease. This structure creates a compelling narrative. It acknowledges strengths, the but. It identifies the barrier, the problem, and it shows the consequence, the therefore, which connects back to the health outcome you want to change. It's action oriented because it points to what needs to change, the situation between but and therefore. Let me outline the components of a strong problem statement. First, specify the population. Who is affected? Not everyone in the county, but adults over 50 with limited mobility in the rural eastern part of the county. The more specific, the more actionable. Identify the health issue clearly. What exactly is the problem? Not just poor health, but high rates of preventable hospitalizations for chronic disease. State the magnitude. How big is it? Quantify where possible. The rate is twice the state average. Identify contributing factors. Why does this problem exist? Draw on your 5 whys analysis. What are the root causes? And cite your evidence. How do we know this? Reference the data sources that support each claim. The community health assessment shows. Interviews with community members revealed. Let me highlight some common mistakes. Too vague. Health is poor in this community tells us nothing actionable. What health issue? What population? How poor? Solution embedded. The problem is we need more clinics isn't a problem statement, it's a solution. The problem might be access to care, but you haven't demonstrated that clinics are the right solution. Premature solutions close off options. Blame framing. People don't take care of themselves puts responsibility on individuals while ignoring context. Why aren't they taking care of themselves? What barriers exist? This framing leads to ineffective interventions, missing the why, describing what the problem is without explaining why it exists. Without the why, you can't design effective interventions. You're treating symptoms, not causes. Let me share an example of a strong problem statement. Adults aged 50 to 75 in the rural eastern region experience diabetes rates 40% higher than the county average. Despite knowledge about diabetes risks, community members face barriers to healthy eating due to limited grocery store access. The nearest store is 15 miles away, and transportation challenges. Many rely on convenience stores for daily food purchases. These factors contribute to diets high in processed foods and low in fresh produce, increasing diabetes risk. Notice what this does. Specific population, adults 50 to 75 in a defined area. Clear issue. High diabetes rates quantified. Contributing factors, food access, transportation, evidence cited, the 40% figure, the 15 miles, and it addresses why. Not blaming individuals but identifying structural barriers. This statement points toward intervention. Address food access, address transportation. Don't just educate about diabetes. Let's summarize our key takeaways from this lesson and this week. Problem statements synthesize multiple data sources, quantitative, qualitative, and asset data, into actionable understanding that guides intervention design. The 5 whys technique pushes you past surface symptoms to root causes. Addressing root causes creates lasting change. The but therefore structure creates compelling narratives that acknowledge strengths, identify barriers, and establish consequences. Strong problem statements are specific about populations, quantified about magnitude, and clear about why the problem exists, and avoid common mistakes. Vague language that doesn't guide action, embedded solutions that foreclose options, and blame framing that leads to ineffective interventions. Congratulations on completing week 2. You now have the tools for AI augmented needs assessment. Next week, we'll explore human-centered design and empathy, shifting from data to deeply understanding the people we serve. Thank you.